Hello, my name is Teresa McLean, and this is the presentation on my grant proposal and poster at Franciscan ACO Mobile Health Clinic to address diabetes compliance. Franciscan ACO is the accountable care organization of the Franciscan Alliance Health System that has locations in both Illinois and Indiana. Originally developed as a health network in 1993, Franciscan ACO is well versed in what is now known as the quadruple aim, which is improving patient experience, overall population health and quality, reducing costs, and bettering the lives of healthcare workers. Franciscan's mission is continuing Christ's ministry in our Franciscan tradition. The ACO demonstrates this mission by providing RN, social work, and pharmacy care coordination services to the patients that it serves. In addition, the ACO is responsible for quality reporting, which is required by the Centers for Medicare and Medicaid Services, or CMS, and contracted health plans. Quality reporting is done on behalf of approximately 1,275 participating providers. This proposal was created to combat barriers relating to social determinants of health and patient compliance. A mobile health clinic could bring disease management services to high-risk populations in areas where transportation means are limited. Franciscan ACO's livelihood depends highly on reimbursement dollars from closing quality gaps in care, and although successful, it's now plateauing because of limited patient compliance. More innovative solutions are needed to ensure optimum care, especially for diabetic patients. The needs statement, there's some statistics that are relevant in this need. Chronic health conditions are the leading cause of death and disability in Indiana and the United States. Per 2019 Americans Health Rankings, adult diabetes diagnoses have increased 23% since 2012. This is actually significantly higher than the national average of 10.5% of overall Americans diagnosed with diabetes. And since the pandemic, those numbers are expected to increase, not to mention the already increased risk of complications from COVID-19. The goal of this project is to measurably improve Franciscan ACO Type 1 or Type 2 diabetic patient compliance by use of a mobile health clinic in neighborhoods or communities identified as having economic or social barriers to regular health care. The hope is to measurably increase diabetic patient compliance using hemoglobin A1C results, preferably below 6%, over the course of 1 year by utilizing program objectives, which are listed in the plan of work on the poster. A pilot program to Franciscan diagnosed or not yet diagnosed diabetic ACO patients ages 65 and older, located within one of 5 identified neighborhoods or communities. Schedule mobile clinic monthly within these 5 communities. Monthly assess diagnosed patients and document routine A1C screenings, diet, health education, and patient-reported health outcomes. And after 1 year, improve A1C results and patient self-efficacy in managing their diabetes conditions. The partners in this project include Franciscan Physician Network, which is Franciscan's owned provider group, and ideally a grant funder such as the American Diabetes Association. The benefits of this program are win-win for the patients, especially those with transportation difficulties to healthcare appointments. This gives them the care that they need. For Franciscan ACO, patient compliance with the A1C testing will meet quality metric benchmarks set by CMS and contractual requirements with various health plans. For timeline and evaluation, the anticipated start date of the program is spring of 2022, ideally May, and will be considered a pilot for 1 year. Once the year rollout is assessed, there can be discussion of additional patients, locations, and services. Vehicle purchasing and staff allocation will take place roughly 3 months prior to program implementation. staff training, process development, stocking of the mobile unit, data identifying patient opportunities, marketing and scheduling will be established no later than April 1st or 1 month prior. And for the duration of the program, that monthly data, which is again the A1C results, diet reports, health education, and patient assessments, will be collected and evaluated quarterly. After 1 full year of performance, the mobile clinic program will undergo full evaluation to determine profitability. Any remaining funds will be discussed with a grant funder and Franciscan leadership. As for budget, the estimated budget for the Franciscan ACO Mobile Health Diabetic Clinic is $484,500. This includes staff salaries, purchasing, signage, and approximate maintenance cost of the vehicle, medical supplies, marketing, and other administrative costs for the 1 year. In partnership with the owned clinicians department, both Franciscan ACO and FPN, hospital departments will match most of the salary and vehicle costs, and FPN and contracted health plans will cover overall medical supplies. The remaining need for funding for the 1 year program is $215,500. This concludes my presentation. I would like to extend acknowledgement and gratitude to the amazing ACO professionals that I work with every day. Their continuous dedication and commitment to our mission and patients is beyond impressive. Thank you for watching. I look forward to your feedback.